The Food and Drug Administration is finally allowing 23andMe to test for the cancer-related genes BRCA1 and BRCA2. The FDA has clamped down and forced the they had, in fact, clamped down and forced the company to verify its generic health risk evaluations. But things are changing now. Now, Dr. Zaher Merhi is here with us, and he's with the New Hope Fertilization Center. Welcome, doctor.
Thank you so much for having me.
Now, I know there's so much confusion because in the past, 23andMe was doing screening, and they would screen you for this gene, but that's different than this new test.
Right.
Can you explain the difference between the two?
Sure. So 23andMe is basically, it's a kit where a patient can spit from the saliva. A woman can test the number of chromosomes that she has, and as a humans we have 46 chromosomes. Now the BRCA1, BRCA2 gene mutations, which are diseases that humans can carry, this new thing that the FDA approved allows women to detect if she carries the mutation or not. Thus, tell the patient if she has an increased risk of having breast cancer and ovarian cancer. So they're a little bit different. In BRCA1, BRCA2, we're targeting a specific gene mutation rather than number of chromosomes.
But this doesn't actually say that you will actually develop it. All it says is that you will have the gene for it.
That's absolutely true, and it's very, very, very good point that you're saying. Now, BRCA1, BRCA2 are genes that we all carry, and they're important genes. They're called tumor suppressor genes. What does this mean is that they protect us and they suppress cancer in our cells. Now, any mutation affects the function of this gene and the protein. Thus, a woman or a man are predisposed to higher risk of cancer. Now, carrying the mutation does not necessarily mean that the person will develop for sure the disease, but definitely increase the chances of having cancer.
There's a little bit of controversy surrounding this because it's a take-home test, and some people would argue that if you're going to do something like this, then you should really be going into a clinic to have it done. Your thoughts?
Good point. However, I think we're more and more the whole medical field is going toward direct-to-consumer tests. For example, HIV testing now, you can order a kit online, and then you can test yourself at home. Even semen analysis, there are kits you order to the house and check your sperm. So I'm not really surprised, and I'm actually happy that these kits, of course they're controversial, there is a lot of ethical things, pros and cons for everything in life, but this kit, I think it's a huge, especially for women who have history of breast cancer, basically.
When we talk about women with a history of breast cancer, what role does race play in this?
Great question. Race and diseases are very, very related. For example, African American has higher chance of having sickle cell disease. Asian population have higher risk of having thalassemia. And here, in this case, Ashkenazi Jews are the most susceptible. They carry the highest number of mutation. That's why actually 23andMe, when they developed this kit, it tests for 3 mutations based on mutation that happen in Ashkenazi Jewish patients. Now, keep in mind there is over 1,000 mutation in BRCA1 and BRCA2, and the kit 23andMe does not test for all of them. It only tests for the 3 most commonly tested ones. So even if the test is negative, this does not necessarily mean a woman does not carry the mutation.
Well, this is an important point because some people feel like, oh, I'm safe if I get a negative test result.
Absolutely not. Keep in mind, the majority of breast cancer cases, first of all, they happen in women who do not carry any genetic disorders. Only 5 to 10% of breast cancer cases that happen in the world are due to gene mutations such as BRCA1 and BRCA1 and BRCA2. So this does not mean, so basically this kit is detecting, a small percentage, which is a significant percentage still, of women who potentially can have breast cancer and ovarian cancer.
So do you think other companies will seek FDA approval?
I think so. I think more and more companies, like anything else in life, it starts with, with any phone, for example, we had buttons, now we have iPhone, right? Same thing. I think the future kits or companies are going to try to detect as many mutations as possible in one sample, and that will probably detect as many as the majority of women who carries BRCA1 and BRCA2 mutation. But keep in mind, again, it's very important for the audience to know that if you carry the mutation does not necessarily mean you're going to have a disease. And if you don't carry the mutation, it does not mean you're not going to develop the disease.
So then why take the test?
Good question. Now, this test is mostly beneficial for women who have strong family history of breast cancer. For example, if you have a woman whose mom died from breast cancer or had breast cancer at age 40, that's pretty significant, rather than women whose mom has breast cancer at age 70, right? Cancer increases with age, but if it happens too early, then there is some genetic predisposition. These women, because their mom had history of breast cancer early on or ovarian cancer, then this population will benefit tremendously from kits like 23andMe, because if they carry this mutation, it's very important to go to the doctor and say, okay, now I carry one mutation, I'd like to do full workup, right? Now, since it's an FDA-approved test, I think doctors will respect more this test now, because in the past, okay, well, it's positive, so it doesn't mean anything. But I think more doctors are going to take this test more seriously. And once a woman is detected with one of these mutations, I think it's very important to sit down with the patient and have a serious conversation as to what the future expectations are going to be. A woman who carries BRCA1 or BRCA2 mutation has 40 to 80% chance of having breast cancer and 40% chance of having ovarian cancer.
So there is a reason for someone to act and actually take this test.
Exactly. Even men.
I want to touch on that briefly.
Sure.
We don't have a lot of time left, but when I took a test for genealogy with 23andMe, one of the things they screened for was BRCA, and as a man, it's one of these things where I thought, well, I'm not susceptible to it. But they asked me an interesting question. They said, do you want to know the answer to this, because it may have implications for the women in your family, and essentially knowledge is irreversible. So with that in mind, what if you test positive for this? Are you then to share it with your family? What do you do, or do you say take your own test?
Right.
Briefly, because we're almost ending.
Great question. These genes are dominant genes, autosomal dominant, meaning if you carry it, half of your kids will carry this mutation. And if you have a daughter, God forbid, who carries
with a daughter.
who carries the mutation because you pass it along, she's at very high risk now. This is serious. But even men, if they carry the mutation, they will also are at higher risk of developing breast cancer and prostate cancer due to the mutation.
Thank you very much. Very insightful.
Thank you so much for having me.